Hello everyone, how are you? Hope all of you are fine. Today I'm going to show you a very important radiological case. This patient is a 28-year-old male having headache and history of fall, has reported to our department, and we have undergone few investigations. Here we can see in T1 weighted image in the right frontoparietal region there is some altered signal intensity area. The same area in T2 weighted image showing some features of altered signal intensity at the same location. If we look at the diffusion weighted image, we can see that there is hyperintensity in those areas, and the subsequent ADC map shows hypointensity in those areas, so it indicates acute ischemic infarct. We have also performed the MR angiogram of this patient. Look at this image. Here we can see this is the arch of the aorta. From here we know that three main vessels arise. This one is the brachiocephalic trunk, this one is the left common carotid, and this one is the left subclavian. Here we can clearly see that this left common carotid goes upwards, and here it divides into internal carotid and external carotid arteries. The internal carotid artery on left side is clearly visible here, but in the right side, if we look at this brachiocephalic trunk, it primarily divides into right common carotid artery here and right subclavian artery here. Here we can see this is the vertebral artery. It arises from the right subclavian artery here. The problem is in the right common carotid artery. When it bifurcates, we can only see there is the presence of only the external carotid artery, but the internal carotid artery is not visualized. If we look at the axial image, here we can see, look at this image, here we can see these are the common carotid arteries on both sides. When it bifurcates, here we can see in the left side the internal and external carotid arteries are present, but in the right side there is no internal carotid artery here. If we look at the circle of Willis, here we can see these two are the right and left vertebral arteries. Here it's visible, these are the posterior cerebral arteries. Here is the internal carotid artery of left side, but in the right side there is no internal carotid artery. Here we can see these are the two anterior cerebral arteries, those are visible here, but there is no internal carotid artery on the right side. We have undergone the Doppler study of this patient also, and we found that there is a blockage in the internal carotid artery on the right side, and there was no flow in the internal carotid artery. So our final diagnosis was large infarct in right cerebral hemisphere and long segment luminal thrombus in whole length of the right internal carotid artery. Thanks for watching our case. If you want to get this type of important cases, please subscribe our channel. Thank you very much.